ADHD in children, obviously we talked about it. Attention deficit hyperactivity disorder. So this is my presentation. It is what is the ADHD? What's its definition? So the definition is like it is a neurodevelopmental disorder characterized by persistent patterns of three things. The first one is inattention, second one is hyperactivity, and the third one is impulsivity. So these three patterns have a lot of signs we are going to discuss later in the slides. So if you are watching these kind of persistent patterns of inattention, hyperactivity and impulsivity, then you are going to term it as ADHD. So these three words are very necessary for your definition. Again, what is ADHD? It is a neurodevelopmental disorder. Alright. It has some persistent patterns of these three things, which I am again repeating: inattention, hyperactivity and impulsivity. Clear? Moving on. So now we are going to take a look on epidemiology of this. This is one of the most common neurodevelopmental disorder in children, which is seen in like 4 to 12 years of age. Especially in pediatrics, we see a lot of cases. That's why we are taking the reference of the most honorable book on pediatrics, OP Guide. And the thing is that it is very common in boys than girls. And the last line, symptoms often continue into adolescence and adulthood. So symptoms are not going to be subsiding until the treatment is made. So this is all about the epidemiology of ADHD. We are moving to the next slide. What are the clinical features? So you're watching this child who is doing the multitasking, who is extra happy. You can say he is very excited and he is in the stage of euphoria, you can see. So he wants to do a lot of things single-handedly. So we are going to talk about what are the causes. So the first cause is obviously hyperactivity. So where is the inattention if we are talking about hyperactivity? I think we missed the slide. Okay, so we missed the slide known as the inattention. So what is inattention? Now we are not going to make the slide again. So we are going to explain you the inattention. What is inattention? In the households or in the general Indian homes, there are the parents who are not taking care of their children, and they are not giving that much attention which is required for a child. For example, they are going and they are busy in doing their jobs and they have no time for their child. So on that thing, the child develops a new inferiority complex towards the parents, that my parents are not looking at me, especially if their brain is developed, like if they are in age of 8 to 12 years. So they feel very sad, and they are always irritated that we are not getting the enough attention. For example, a child who is of 10 years of age, he is continuously punished in the school. Nobody cares about him or her. And the same scenario happens at home. The parents are returning from the job, but they have no time for children. They have no time for at least talking to them. And the thing is that the whole week begins, the whole week passes out, but the parents are not talking to the child. So this develops the inattention in the children. That is the inattention. Now we are going to talk about hyperactivity. I hope you got my point. So hyperactivity is like as you are watching the this photo, I already explained it, that the child is trying to do a lot of things, that he is constant fidgeting, fidget spinners. So doing something with their a lot of movements. Cannot remain seated. Child will not remain seated. He will just continuously rattle around surroundings. Running or climbing excessively. He will run and climb, obviously. He talks excessively. Hyperactivity, of course. So talking will be also hyperactive. He is always on the go. It means that child is not going to be static. He will be continuously doing something. So that is known as the hyperactivity. Now we are moving on to the C, impulsivity. Impulsivity, I'm sorry. What is impulsivity? So we have 3 or 4 bullets on this, like interrupting others. Child will be continuously interrupting others. He will disturb everyone. Answers before the questions are completed. Now this is a very very important point of impulsivity. We have seen a lot of children in the schools, especially when a very easy question is asked or a topic which is asked to the whole class. But these kind of children, they are answering and they are not waiting for their turn. That's exactly the next point is. They are not waiting for their turn, they are just answering it before the questions are even completed. So this is also a sign of impulsivity. They are acting without thinking. And due to these reasons, due to these things that they are, over exaggerating over the topics, there are the risks of accidents. If a child is doing this in the class, so it might feel very, it might feel a hardship even during crossing the roads. So that's why there will be a risk of accidents. So this is the impulsivity. Again, we want to revise it. ADHD is a disorder which has the persistent of 3 things. The first one is inattentiveness, hyperactivity, and impulsivity. Now, obviously, the most thing we have discussed. Now we are on the causes. What are the causes of ADHD? How ADHD can happen, and what are the core and major causes? The first cause is like genetic factors. Obviously, nothing to explain about this. Strong family history. You need to take family history of these kind of patients. Even the parents have ADHD, then it might also be very very streamlined or continuous to the next progeny or next generation. High, hereditability. Inheritance we have studied in the 12th class. So these things can be genetic, can transfer from parents to child. Brain abnormalities. The brain is not developed well. Reduced activity in the prefrontal cortex. Alright. Dopamine and non-epinephrine imbalance. This is very important. Like you need to this is one of the major cause. The child is not getting the enough dopamine and the imbalance of the non-epinephrine. Some risk factors we are going to talk about. If a child is having ADHD, then these kind of the risk factors might occur, like prematurity. The child will not be matured enough. The child will having a low birth weight. It has for example, you can see maternal smoking, alcohol exposure, the lead exposure, and the perinatal birth injury. So these things are the risk factors of ADHD. Because if a child is going to be a hyperactive or always irritated and doing the which he shouldn't do or she shouldn't do, then he will go low birth weight. He will not eat properly. He will not able to manage the things properly. So all of these, and the most risk factors are like prematurity. If the child has been not developed well, the child was from the IUGR, okay, or the child was having a perinatal birth injury. It means the birth injury happened in the womb. So these things are the risk factors. So we have seen all the causes and risk factors of ADHD. What are the clinical features? So now how you are going to diagnose a patient or a child which is having ADHD, how you are going to diagnose? So the first thing is that the child is having inattention. So the child may make careless mistakes, all right, fail to pay the attention, not listen when is spoken to. He might forget his homework. He might carry all his bags, or he might forget all his you know, stationary items like your books, pencils, and toys, he will be easily distracted. That is the most important thing, and forget the daily activities. So this is the cause of inattentive ADHD. It means the quality, the skill which is known as the attentiveness, it is slightly gone in these kind of children. We are going to talk about the types of ADHD now. I hope you are getting the point. The types are like three types. The two types and the combined type. The predominantly inattentive type, the predominantly hyperactive impulsive type, or the combined in the both ways. And they especially we talk about predominantly inactive type, then it is going to be attention problems, which I talked earlier in the second slide. If it is due to hyperactivity and impulsive behavior, so these kind of things, and combined type is going to be both with inattention and hyperactivity. So these are types. You don't need to focus about these, only learn the headings of these. Examiner will not ask these kind of questions, might put up in 2 marks. We are going to make a diagnosis on this. So diagnosis should be made clinically. Symptoms should be when to make the diagnosis. This slide is all about when to make a diagnosis of ADHD. The first thing is the diagnosis should be clinical. If symptoms persist for at least 6 months, if a child is showing the ADHD symptoms for at least 6 months, then you need to make the diagnosis. If the problem begins before the 12 years of age, then also you need to make a diagnosis. Okay, and cause significant impairment, all right, not be explained by another disorder. Good. Information should be gathered from from where we should gather the information. If a child is coming at you, OPD, so the whole information about the child which you should gather from his or her parents, teachers, caregivers, and a clinical assessment should be made. Now, what are the differential diagnosis of ADHD? So the differential diagnosis, you need to learn 4 or 5 of these. So like autism spectrum disorder, okay, the learning disability, depression, anxiety disorders, intellectual disability. Child may not be able to answer even the basic things. Depression, child is not sleeping properly, or thyroid disorders. What are the management of ADHD? So the first management of ADHD is parental counseling. You need to counsel the child and his parents. The second thing is that explain ADHD in a medical condition, not bad behavior. The parents are already frustrated with the child, like if he is doing all of these activities like inattentiveness, hyperactivity, and impulsivity. So parents are also sometimes frustrated. So you need to explain the parents that, sir or ma'am, this is not a bad behavior, this is a medical condition. All right. Encourage consistent results, routines, and positive reinforcement. All right. Do this kind of rehabilitation. Now do the behavioral therapy. The behavior. Okay. So what are the behavioral therapies, which is already written in the Ayurveda, in Sadvit Adhyay, and also it is written in Satyavajaya Chikitsa. That's what allopathy also says, that the positive reinforcement should be done, reward system should be given, that yes, today if you are going to complete your homework, then we are going to give you an ice cream treat. For example, if you are today you are going to complete your mathematics homework, then we are going to give you a very, very nice treat. You are going to watch your favorite cartoon or favorite movie, we are going to watch it together. If you are going to complete your homework at this task, then we are going to play a video game with you. So these kind of reward systems should be given. Okay, structural schedules, not very hectic schedules, should be given. Classroom behavior management should be done. All right, and parents training should be done in these special cases like ADHD. Got it? Now, what are the medications provided on ADHD? According to allopathy, we have ADHD stimulants and non-stimulants. So the stimulants and non-stimulants are given. For example, now we have stimulants. What they are doing? They are increasing dopamine and norepinephrine. Okay, that boost energy, attention, and alertness. Of course. So what are the drugs we are? Either we have methylphenidate based drugs. These kind of drugs are given. So this is the most common. That's why we are pronouncing immediate or extended release, and extended release is less likely to be abused. So these drugs are given according to according to the age, height, and the weight of the children. So these kind of drugs like stimulants and non-stimulants are given. So you don't need to learn all these drugs. You just need to learn what it works. Like non-stimulants, if we talk about, so it doesn't work as quickly as stimulants. All right, it has no side effects than stimulants. So non-stimulants have no side effects, less likely to be abused than stimulants. All right, may be able to treat ADHD as well as conditions like tic disorder. So the toxicity, if we talk about, stimulants have the more toxicity than non-stimulants. So the drug which you need to remember is methylphenidate. What is the Ayurvedic management? So I'm a BMS Medico, so I'm just going to give you the Ayurvedic medical management also. So with respect to Ayurveda, if we talk, what is this disorder? अगर आयुर्वेदा की बात करें तो आयुर्वेद के हिसाब से अब कैसा डिसऑर्डर है? आयुर्वेद के हिसाब से ADHD में वात प्रकोप होता है। आयुर्वेदा गुणों को मानता है, मानसिक गुण सत्व रज और तम, तो यह रज गुण का प्रीडोमिनेंस दिखाता है। और अगर हम स्रोतोदुष्टि की बात करते हैं तो स्रोतोदुष्टि में यह मनो व स्रोतस का तुष्टि करता है, जिसके कारण इसका स्थान संशय होता है मनो व स्रोतस में। तो इसके कारण से यह मन में विकृति उत्पन्न करता है, जैसे इम्पेयरमेंट ऑफ घी, कृति एंड स्मृति। सो घी इज़ नथिंग बट इंटेलेक्चुअलनेस, कृति इज सेल्फ कंट्रोल, एंड स्मृति इज मेमोरी। सो स्मृति का ह्रास होता है, यानी लॉस होता है। सो वी आर गोइंग टू लुक एट द आयुर्वेदिक ट्रीटमेंट ऑफ दिस। सो आयुर्वेद में एक्चुअली हम लोग वी आर गोइंग टू गिव मेद रसायन। तो मेद रसायन क्या करता है कि बूस्ट करता है आपकी ब्रेन फंक्शन को, सपोर्ट करता है, थोड़ी सी कामनेस को प्रोवाइड करता है। सो दीज आर हर्ब्स ब्राह्मी, मंडूक, पर्णी, शंख पुष्पी, यष्टि, मधु एंड गुरुजी। सो दीज ड्रग्स आर गिवन। समटाइम्स सरस्वता इज ऑल्सो गिवन, समटाइम्स ब्रह्म रसायन इज गिवन, एंड स्वर्ण प्राशन इज ऑल्सो डन इन अर्ली न्यूनेट्स। So we will see it. Panchkarma therapies. I'm sorry, not in early units, but in children Swarnaprasan is done. I'm very sorry. अर्ली यूनिट्स नहीं बोल रहा था। पंचकर्मा थेरेपीज़ भी हम कर सकते हैं बच्चों में, जैसे कि शिरोभ्यंग करते हैं, शिरोधरा करते हैं, नस्य करते हैं, तक्रधारा करते हैं, मात्रावस्थी करते हैं। सो व्हाट इज़ द बेनिफिट ऑफ शिरोभ्यंग? इफ़ यू आर डूइंग द शिरोभ्यंग, then also it is going to stimulate the brain, the nerve supply, the blood supply will increase, and that's why the working and functioning will be better. Shirodhara is done. It is a Panchkarma therapy which calms your mind. Nasya therapy is done क्योंकि कहा गया है नासा ही शिरसोद्वारम. So that's why every औषध द्रव्य or any drop you are putting in the nose, it has straight connection with the brain. Takradhara is done. It's like a Shirodhara, and Matravasti is done in special cases. लास्ट में आहार विहार का भी काफ़ी मतलब होता है। आहार विहार आयुर्वेद मानता है, अगर आप पोस्ट ऋतिक्ष आहार करते हो तो वैसे ही आपकी जो ब्रेन की फंक्शनिंग है वो थोड़ी सी इरिटेटेड रहेगी। आप पथ्य आहार करते हो, पथ्य अपथ्य मीन्स what is good for our body, what is taken on the regular basis. So Pathya is lifestyle and diet, regular sleep schedule, fresh nutritious diet should be given, yoga and meditation should be given, reduce excessive screen time. This is the most thing now. No one is escaping from this. Encourage outdoor play and structural routines. So if the child is playing outdoors, he is playing cricket or badminton, then also his brain functioning will increase and He will not be irritated all the time that I am not getting the enough attention. He will get attention from the players. He will be happy by hitting a six maybe. So indulge in the activities where you know the things like uh, you you must go out of your breath in case of the ADHD. A lot of adults are also having ADHD, so they need to you know make their schedule like that they must go out of the breath, like running, cycling, squash, or cricket. When they will get out of the breath, then there will be only one chance that they will try to breathe, so there will be no negative thoughts coming on that. I hope you got it. Integrated approach. So the best outcomes are generally achieved through the combination of parent education in children, behavioral therapy, school support, medical evaluation, Ayurvedic supportive care under a qualified practitioner where appropriate things should be given. So these kind of integrated approach, if these all people like parents, school, or medical evaluation should support, like parents are you are educating the parents who you know whose child is suffering from ADHD, and they are understanding that this is not this is not a bad behavior, this is actually a medical condition. So the parents are taking care of the child now the behavioral therapy is given to the child that this thing is not appropriate. School support is there that this child is suffering from ADHD, then we must support the child. We must give him the special privilege. We must give him not create those surroundings where the child is getting irritated, and we must give medical evaluation of these children, a proper medical evaluation, proper chief complaints, proper medical history, proper family history should be given, and also Ayurvedic supportive care should be given. So all of these things, if work very integratedly, then it is going to be very beneficial for the children suffering from ADHD. Okay, thank you very much. So this topic is done. Subscribe to this channel, and more videos are coming on science topics. Also follow me on the Instagram for the further queries. और सभी को जय श्री राम. I hope you got my topic. We will meet you on the next topic very soon.